Okay, it looks like people are joining. Welcome, everybody. We are just going to get started with our BPD Fest Month webinar. This is the second webinar in our four-webinar series. We are delighted that you can join us today. My name is Paula Tusiani-Eng. I'm one of the co-executive directors here at Emotions Matter, and we are going to get started with our panel in just a moment. We want to welcome you here at Emotions Matter. If you're joining us for the first time, we're glad you're here. If you're returning, it's so good to see you. Take a moment now and tell us where you're coming from in the chat. Feel free to just say your name and where you're coming from geographically so we can see where our audience is from. In the meantime, I'd like to introduce a little bit about Emotions Matter. Emotions Matter is a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for people impacted by borderline personality disorder. This is our 10th anniversary as an organization, and we're just really delighted to be here. Our vision is to create a world in which every person impacted by BPD has access to treatment, resources, and support to achieve a meaningful recovery. To learn more about us and our programs, you can go to our website at www.emotionsmatterbpd.org. And, we always like to start off our webinars by acknowledging our sponsors that make programs like this possible. As many know, Emotions Matter serves thousands of people a year across the United States and abroad in our peer support group programs, which are offered at no cost to the community. But we're able to provide those programs and programs like this because of the generosity of our fiscal sponsors, New York Presbyterian Hospital, the Francesco and Mary Giambelli Foundation, the Karen Lerner Family Foundation, the Fishman Family Foundation, Mass General Brigham McLean Hospital, Silver Hill Hospital, the Colbeth Family Fund, Bullring Engelheim, Eastern Services, the New England Personality Disorder Association, DBT Works, and NEA BPD. Thank you to all of our sponsors. Without you, we wouldn't be here. And we just appreciate all that you do for us. Just a little bit before I pass it over to our moderator, I'd like to just tell you a little bit about what to expect in terms of our structure tonight. Our structure is that we'll have a few moments of introductory comments and remarks, and then we're going to have a panel discussion. It'll be a moderated panel, and then there'll be some Q&A at the end. We try to allow at least 10 minutes for Q&A. And then there'll be closing announcements. So this is just a little bit about the structure for our webinar this evening. And at this point, I'm going to turn it over to Dr. Alex Stein, who is moderating from our board tonight. Thank you, Alex.
Thank you, Paula. It's wonderful to be here. So I'm going to start by talking about Emotions Matters philosophy. Emotions Matter strives to create a safe, judgment-free space for people with borderline personality disorder. We accept that there's a spectrum of experiences within the BPD community. We honor where people are on their journey without judgments or assumptions. We encourage people to define their own path toward recovery. We speak as experts of our own lived experience, not as medical experts. Professionals on our BPD Fest panels are volunteers speaking for educational purposes. So our guidelines for community engagement are as follows. Questions during sessions should be asked only using the Q&A box, not the chat. Comments can be made in the chat box. Use respectful language in the session chat. Any inappropriate messaging, including harassment, bullying, or monopolizing the chat, will be deleted. We accept differences and promote acceptance, especially with regard to gender, sexual orientation, identity, race, ethnicity, age, religion, disability, or politics. Avoid explicit expressions of self-harm or trauma, which may be upsetting to others. Panels and plenary sessions will be recorded and after the conference. No screenshots or recording on personal devices. If at any time during BPD Fest 2025, you find yourself overwhelmed, struggling, or for any reason in need of support, we encourage you to reach out to your support system. Audience members may experience intense and painful emotions, feelings, memories, thoughts, and/or reactions to content shared. Participate at your own risk. You are welcome to take a break from BPD Fest 2025 at any time or withdraw from it entirely. In the event of a medical, including mental health emergency, please seek care through a doctor, hospital, or emergency call number such as 988 or 911 in the United States immediately. Okay, I'm going to now introduce our speakers. So starting with Dr. Alexander Shep, who is a psychiatrist, psychotherapist, and psychoanalyst in private practice in New York City. He is an assistant professor of clinical psychiatry at Columbia University and specializes in the assessment and treatment of personality disorders in youth. Ashley Body was diagnosed with borderline personality disorder at age 17 in 2007. That diagnosis changed everything. It gave her a way to understand her experiences and finally start getting the right kind of support. She now uses her experience to advocate for people with BPD, especially in the workplace and professional settings. She hopes to make these conversations easier for others and push for better pathways to care, making sure others don't have to fight so hard to be heard. Akansha Veer is a small business owner, certified life coach, and intuitive healer. She finds purpose in volunteering as a peer facilitator with Emotions Matter, where she serves as a board member of the Events and Fundraising Committee. She's passionate about supporting young people and those affected by BPD. She brings lived experience, compassion, and holistic insight into her advocacy work. And last but very much not least is Brianna Hauser, who is a 17-year-old from Philadelphia who's in the 11th grade. She was first diagnosed with BPD at 15 years old. She has dealt with serious self-destructive behaviors and suicidal tendencies because of BPD. Brianna hopes to help educate people about BPD in adolescence and how it can affect someone's life. And I will let the panelists take it away.
Okay, Alex, you can you advance slides for me as we go along?
I think Paula will do that.
Paula. Okay, great. So I'm thanks for having me. I really appreciate it. Happy to be here. I'm just going to speak for a few minutes to get us started talking about diagnosis and treatment of personality disorders, just a kind of a brief overview of how we approach that as clinicians to give us some structure before getting into the rest of the panel. Can we pull up first slide for me? Yep.
Can you see the slides?
Yeah, we can see them. Any way to make them full screen?
Yep.
That should be good. Yeah, okay. Yeah, so great. So there's a couple ways we think about diagnosing BPD these days. One is the one that people are probably more familiar with, which is in the front of the DSM called the categorical diagnosis. What we look at here is we're looking for what they describe as a pervasive pattern of instability of interpersonal relationships, self-image, and affects or emotional states, and impulsivity beginning by at least early adulthood and presenting in a variety of contexts. And some of the common symptoms, of which you need at least 5 to meet criteria for this diagnostic system, would be efforts to avoid real or imagined abandonment, unstable and intense interpersonal relationships, unstable self-image, impulsivity, suicidal behavior, gestures, threats, or self-injury, affective instability or emotional instability, feelings of emptiness, intense anger or difficulty controlling anger, and at times feeling like people are really against you in a way that is sticky and hard to control and manage. So by this way of diagnosing, if you meet criteria if you have at least 5 of these symptoms going on. Could we advance the slide? So another way that is more traction these days in terms of diagnosing personality disorders is what we call a dimensional diagnostic system. What that means is that, personality functioning exists on a continuum. Not necessarily just you have it or you don't, but rather we all have different traits and characteristics. And to meet criteria for borderline personality disorder, fundamentally what we're looking for are disturbances in self and interpersonal functioning. So that's really at the core of it. And we're also on the lookout as part of that for things like identity disturbances. So an unstable or rapidly fluctuating sense of oneself, difficulties in forming goals and pursuing them effectively and productively, difficulties with understanding and appreciating, conceptualizing what's going on in the minds of others in a kind of complex, nuanced way, tolerating differing perspectives, and understanding the effects one's behavior has on others, and an ability to form intimate, dependent, loving, cooperative relationships that last over time. So if people have difficulties in these areas, they might meet criteria for a personality disorder in general, including borderline personality disorder. This is a little bit more modern system that I just want to bring to people's attention. It's in section 3 of the DSM. Okay, next slide. So one question that is often raised and is one particular focus of this panel is the concept of diagnosis under the age of 18. There's a lot of kind of misconceptions floating around. A lot of people will say that you can't be diagnosed with a personality disorder under 18. And we just want to kind of bust that myth. So BPD and other personality disorders can and should be diagnosed under 18 if people meet criteria. This is recognized by several international organizations and prominent US organizations like the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. A lot of people will say the DSM prohibits diagnosis under 18. That's actually not true. The only thing it says about age is that typically personality disorder features begin in adolescence or early adult life. And if you're under 18, you should have these symptoms that I've been describing for at least 1 year. That's really all it says. It doesn't say that you can't diagnose under 18. In the recent American Psychiatric Association practice guidelines for treating BPD, they're very explicit in saying that it's a major misconception that BPD only occurs in adults. They say that adolescents can meet criteria for BPD and benefit from the treatment aimed at it. And it's important because actually studies that examine how prevalent it is or how many people have BPD in adolescence, up to 1/3 of adolescent psychiatric inpatients actually meet criteria, and something around 1/5 of psychiatric outpatients. The general population, it's like 1 or 2%. But in psychiatric, treatment settings, it's actually really high. It's really common. Okay, next slide. Just to speak a little bit too about treatment. So there are a variety of evidence-based treatments for treating BPD. This includes probably the most common or popular treatment of dialectical behavior therapy, or DBT. There are a couple of other a little bit more common treatments, mentalization-based treatment, or MBT, and transference-focused psychotherapy, or TFP, among others. The 3 that I've outlined have specific treatment manuals for young people, for adolescents and young adults as well. Okay, next slide. All right, and I think this is my last slide. So treatments take different approaches with some common features. So DBT is a skills-based approach. It basically takes the stance that folks with BPD benefit from learning and practicing skills in different domains like emotion regulation, interpersonal effectiveness, distress tolerance, and mindfulness. And that typically in 6 to 12 months of treatment, people improve a lot. TFP and MBT take a little bit different approach, which involves examining the patient's relationship with the therapist to look for things like black and white thinking in their experiences of themselves and the therapist, to hopefully pull those things together, integrate them, make them more nuanced and complex, and reduce the emotional difficulties and behavioral manifestations of difficulties in self and interpersonal functioning, like I mentioned earlier. All of these treatments are equally effective. They have common factors. They all emphasize a really careful assessment, sharing the diagnosis with the patient, setting goals, a hierarchy of priorities in treatment, like addressing safety, things that would get in the way of treatment progressing effectively. And just one note about medication. This is one reason why diagnosis is really important. There are no medications that are FDA approved in the United States or elsewhere for treating core symptoms of BPD, but we have really effective treatments in the form of psychotherapy. So if people have more than one diagnosis, which they often will, you should treat those. Like if you have major depression, in addition to BPD, that should be treated, and medication may help there. But if the core diagnosis is BPD, oftentimes what I will see as a psychiatrist is people will be put on a lot of medication, a lot of which is not really indicated, rather than being in the appropriate psychotherapy setting. And so diagnosis is really critical to figuring out the appropriate treatment and getting people the help they need. So I'll stop there, and we'll shift to the rest of the panel then.
Okay. So this is the questions. Okay. So I have a number of different questions for the different panelists. So we're going to start with, when did you first recognize BPD symptoms on your mental health journey? I don't know if anyone wants to take that one first.
I can take that one, Alex. So I think looking back, I can see that the BPD symptoms have been a part of my life long before I ever had the words for them. When I was about 20, I hit a crisis point. I had gone to London with my boyfriend expecting a proposal. Instead, he cheated, everything fell apart in my world. I attempted to overdose, and that led to a series of diagnoses. First bipolar, ADHD. I had a dual diagnosis because of my substance use. I don't think any of them ever quite fit. And as Dr. Alex mentioned, I felt like a lab rat. I felt like one medication after another, and I just felt lost in the system for years with nothing working. It wasn't until 2020, after an in-depth neurological assessment, that I was finally diagnosed with borderline personality disorder. So getting that diagnosis was like turning on a light bulb. I could finally understand why I felt the emotion so intensely. The DBT, everything just clicked and made sense. But yeah, I felt overwhelmed with relationships, and I think I could have been better supported if the people around me, especially family and professionals, understood that my behavior wasn't about being dramatic or difficult. I just needed to I needed someone else to stay calm when I couldn't, and to hold that space for my emotions without judgment, and to remind me I was still lovable when I felt like I was too much. Just needed a little bit more patience, validation, consistent support. I think that would have made a huge difference during the years when I didn't really know how to help myself. So to families and communities supporting someone with BPD, your love, stability, and willingness to learn can be life-changing. Recovery isn't linear and it takes time, but feeling believed in and not abandoned makes all the difference. And then just being there with kindness and curiosity instead of judgment, I feel can help somebody hold on long enough to find their way through. Thank you.
I think Alex, you're on mute.
Yes, I am. I said that was beautiful. Thank you, Akansha. It was really nice. Does anyone else want to jump in with the answer to that question? I can repeat it if needed.
I can.
Awesome.
I've always had some like symptoms here and there, just like constantly being like, oh, are they even coming? Like my friend, like, are they coming? Are they coming? That was like a whole life thing. But everything came together when I was like 13, 14, where no one would ever understand why I'm so sensitive, why what everyone else seemed to be the littlest things affected me so deeply. And I would always be called like, if I attached to someone, everyone would be like, oh my God, you're so obsessed with them. You're so obsessed with them. And it's like, it always hurt to hear because I don't know, that word just always bothered me. People telling me you're so obsessed because I'm like, no, I just care so, so deeply and just no one seemed to understand. And that also fell into just severely fearing abandonment, because then I would care so deeply and someone could look at me slightly weird and I'd be like, this is it. This is the first sign to a pattern that they're going to leave me. And it just, yeah, at like 14 or 13, that is when every symptom just came together. Just
Thank you, Brianna. Ashley?
Yeah, I guess for me, I noticed now that I look back on it, I think I noticed around 8-ish to 9, kind of like when you start to get friends and differentiate yourself and you're supposed to become like an independent person. And I found that I would lose friends really quickly because of kind of my over attachment to them, or, manipulating in order to kind of drive the situation the way I wanted it to be. And so it didn't click until the outside behaviors started. The impulsivity, the self-harm, the suicidal ideation, things that were more physical. I would say around like junior high to high school, I had like a summer that I feel like was the summer that things happen. And you kind of just I think why it's so hard to diagnose young is because there is a parallel. And I always felt like there was a parallel when I was like really deep in it and when in my younger ages. The problem was I always took it to like a level too far. And that's when I really started noticing in high school for sure. I was like, oh, okay, why is it that I'm, out till God knows when, and other people can, go home at the end of the night? Or why am I more willing to, push the boundaries and things like that? And, I got nicknames that reflected that. And so it also fed into, okay, maybe this is me. Maybe I'm the crazy one, the one that does all the, the drugs and the alcohol and all of those things. So it also was just hard to navigate my own self when I really felt conflicted in that. But I really think that my family was kind of my grounding force. If I didn't have them, I don't think I would have made it through basically until I was 18, so to speak, because it was a whirlwind. And it was because of them that I was able to stay, on the right path. It was because of them taking me to the hospitals. It was them trying to understand what I was going through. They made their mistakes. They thought, treating the symptoms and stuff like that. But having them really by my side, I feel like made a whole difference in how I turned out to be today, because I didn't feel like they for some strange reason understood, and they didn't always make me feel like the crazy one, so to speak. I felt like they were reading books about it now that I think about it, like behind my back, to figure out how to cope with the way I was. But it's definitely been it's been a really long challenge, but I am the biggest advocate in the world for diagnosing young. I really think it makes a huge difference, especially when it comes to the symptoms of like impulsivity and self-destruction. There are so many bad places I could have been that I'm not at now, because I got them all out, I guess, so to speak, out of the way when the damage wasn't as detrimental. So yeah, I'm just really grateful for, everything and this whole experience.
Thank you so much, Ashley. I'm excited to hear more from each of you. So we're going to talk about the next question, which is which symptoms presented the most and how did they impact you? Do you want to do the same order?
Sure, I can tackle this one first. What symptoms? I think a lot of us already mentioned this, but my most intense symptoms, I would say, is the emotional dysregulation and anger. I used to get very overwhelmed. I mean, I still do. It's a process, but I would get overwhelmed easily and lash out, especially at home. I would scream, throw things, and just say very hurtful things. And I wasn't trying to be cruel. I would regret it like after the fact. I would sit there and feel shame and guilt, but I think I was just drowning in the emotions and I didn't know how to manage them. So I think that would be a big symptom. And another one is just me struggling at work. Um, Not being able to keep up with my team members, just the pace, and then also the relationships. I struggled with interpersonal relationships and the relationships with my team members. I think it's easy for me to, like Brianna said, I see one wrong look and it's like, well, they hate me. Like, I want to quit. Like it just went from 0 to 100 with my symptoms. And again, a few other people mentioned like being sensitive and I think my best friend used to call me a crybaby in high school. So that really stuck with me because, or lazy, she used to call me lazy. And I was not trying, looking back, I wasn't trying to be lazy or too much. I think I didn't have the right tools. Um, so that's been, I think, the biggest challenge even now. Thank you.
Thank you. Brianna.
Fear of abandonment is definitely what presented the most, but also besides that is splitting and impulsivity. And what I mean by splitting is I would seriously, there would be someone I'm like, you mean so much to me. I care about you so much. I love you so much. And that was my basis. I always did. I always did love them. But if one day they were like, "Hey, Brianna," and then the next day they're like, "Oh, hi, Brianna," that slight change would be like, oh my God, you hate me." And then I feel like I would have to be like, "Fine, I don't like you anymore," in a way to protect myself. And because of that, then I would end up like self-harm, just self-destructing because I'm like, is it my fault? Is it all my fault? And seriously, like, just if someone looked at me slightly wrong, I'm like, okay, flip out, could not handle it. I'd just start crying and being like, you hate me, you literally hate me. Or I'd have to act like, no, I don't like you, I don't care about you, because I feel if I step away first and not give you the chance to abandon me, at least I'm protecting myself.
Thank you, Brianna.
So for me, it was definitely the impulsive self-destructive behavior that affected me the most. I think I used substances to cope, and that was where my impulsive and self-destructiveness came from. If I remember a time in high school, I think I plagiarized an essay, and of course I got caught. And next thing you know, I'm in like the psych ward, because I went on a bender and I was suicidal and I was drinking and doing all sorts of things. And so little stuff like that led to decision, like I want to say like big people decisions, that really, in all honesty, I think would have completely destroyed my life, and been places that I would have been stuck. For example, if somebody, if I get into a fight with my boyfriend, my cope is no longer to go drink and just like forget about it. And then as you're drinking, you just, things keep happening. You just follow and follow and follow the path until you end up in a hole. Sometimes now I would say I am still a little bit impulsive, but it's not as extreme. It'll be like maybe I put an extra thing in my Amazon cart, or I'm like, you know what, I'm gonna DoorDash because I feel like it. And so it's like changing what is the self-destruction or the impulse now, that it's not so horrible. So I'm not like drinking for 4 days straight and blowing up my life and self-sabotaging relationships. I'll be like, oh man, shouldn't have bought that extra dress, or I've been eating ice cream for 4 days and I know it. But it's hard to learn that kind of self-awareness. But yeah, I definitely say impulsive and being self-destructive were very impactful in my life.
Thank you, Ashley. I just wanted to let the panelists know, if you don't see this, there's lots of nice messages coming in. A lot of people are finding your stories really relatable. So thank you guys again for being here. Did you experience any challenges accessing care or getting a diagnosis?
For me, I faced a lot of challenges accessing care and getting a proper diagnosis. When I didn't have insurance through work, it was almost impossible to find affordable therapy or psychiatry. The wait lists were sometimes over a year long. And when I finally did see somebody, the process just felt very rushed or incomplete. Some doctors would just hand me a questionnaire and base their entire diagnosis on that without really digging deeper into what was going on. The one diagnosis I got at 20 kind of stuck with me. And I remember a doctor saying, "Are you sure you're bipolar?" At that point, I thought maybe bipolar. She's like, "Because once we put this in your record, it's staying forever." So like, I think just without that understanding, it took a while for me to get the care that I needed. And then finally it took maybe 4 or 5 years to find Emotions Matter, where I felt like I had a community that also was able to validate what I was feeling and going through. So I think it's kind of consistent throughout our community that we don't have access to care. And it's not only care, it's quality care, where someone can take the time to listen to, my full story and really assess properly.
Okay. I'm gonna mainly point this towards the diagnosis part. I could talk about this for hours, but I'm gonna sum it up as much as possible. Um, so I first got diagnosed at 15. Like I just turned 15, and there was a situation at a school where I got really, really attached to this counselor, and the school didn't like it at all and made her send me an email saying, "Hey, I'm really never going to see you again." After she's like, "No, I'll never do that to you." And that was the first time in my life I truly lost control. And it was about a month after that, I saw a psychiatrist and she did all the assessments and was like, "Hey, like all of your symptoms point towards BPD." Now, at the time, me and my parents knew absolutely nothing about it. We never heard of borderline ever. Um, and she's like, "But I'm very reluctant to diagnose you because you're only 15." Okay. Me and my parents, we looked into it and we're like, "Oh wow, like that explains everything I struggle with exactly." And then I've been to 3 different residential treatment facilities and just in and out of many treatment facilities. And every therapist I've had has been like, "Yeah, it couldn't be more obvious that you have BPD." But then I would see the psychiatrists before in every treatment who would do the assessment and be like, "You have every symptom, but I'm going to rule it out until you're 18." And that just always really, really upset me because it's like, why are you going to hold that off and be like, "Hey, when I'm 18, just kidding, you had it this whole time." Why not help when at a younger age when you know you have it so you can progress further and quicker as you go on in age. But I was 16 in my third residential when there was a psychiatrist who told me, like, he did the assessment on me again and said, "Yeah, no, you definitely have BPD. I'm gonna diagnose you." Because I was just so happy that he was like the one psychiatrist I've had that truly understood that you can have BPD under 18 if you've had persistent symptoms for over a year, and that truly made a big difference.
So for me, I would say initially I did have a little bit of a hard time finding treatment and things. But I honestly want to say part of that had to do with the fact that BPD really wasn't widely recognized at the time. I think I remember one time seeing it referred to as like emotional dysregulation disorder or something. So it wasn't exactly like, okay, that's what we're going to go to. And then, so I was pretty much getting bounced around for treating things like depression, substance abuse, all of those things, mood swings, self-harm. And then I feel like also though, like, was said earlier, I grew up in New York. And so I did have access also to really good healthcare through, my parents' corporate jobs, so to speak. And so that actually allowed us to kind of bypass, the longer system of, referrals and all of those other things. And the fact that, in all honesty, Emotions Matter started in New York, I feel like for a reason. And most of that is they're a little bit faster with, wanting to be breakthrough and have change. In fact, I think I was like 16 and I was at Mount Sinai's like first DBT skills thing. And I looked it up the other day and it's like this huge program. I'm like, oh, when I went, it was like a little bitty thing. So like, while at first it was hard for me to get the diagnosis just because people were like, I don't really know what that is. Once I got it, I had access to everything, but that really was dependent on the kind of insurance I had because even with really good insurance, I still had to pay out of pocket for certain types of therapies and things like that to help me really get on track with my life. But it was definitely worth it, and I'm forever grateful of my situation, particularly being in New York. And I think some of the donors, Weill Cornell, I was over there for a little bit in their residential upstate, so it's been a whirlwind. But I would say, location and unfortunately, funds and stuff made it accessible for me.
Thank you guys. We have 4 more questions. I think what I'm gonna do is like set a timer for about like 1 minute each for each of the remaining questions so that we can get to some of the chat questions in the end. So the next question is, how have you managed symptoms and moved forward on your journey? So maybe think of like some of the most important pieces that helped you on your journey.
Okay. For me, I think doing deep inner work, being compassionate with myself, and also learning and educating myself about the topic really helped. So when I did do DBT, I was able to understand some of my thought patterns and kind of focus on some of those behaviors. I also use exercise and eating healthy as a way to stay grounded and balanced. I'm not as moody, I would say, but yeah, being compassionate with yourself, finding a community. For me, it's Emotions Matter, and just having a good support group. Okay, wait, one more thing is I have a list of my triggers, and then when I am about to get a little bit hard on myself, I go down my list and kind of find ways to give myself love and the compassion that I really need. So just being aware and having a good support system and having someone to call, that also helps. Thank you.
I just want to say I agree so much with the self-compassion. It's so important. Brianna.
Okay. So I'm still 17, so I struggle a lot every day with it. But I can say that I now do things differently than I would have a year ago. I am a lot more able to try to control myself from if someone says something that really bothers me, instead of just quickly lashing out, thinking about what has happened to me in past situations and when I lashed out like that, and how did that turn out? And sometimes it's not that easy because your brain just completely loses control, and it's not that easy just to be like, oh, just think about it. It's really not. But
Brianna, do you ever think of it like beforehand. So like before you even get into that situation, like, you know, when you've engaged in certain behaviors in the past, like, you know what the consequences will be, so that when you're in that moment, it feels a little bit easier to access what the consequences might be.
There's a lot of times, like, if someone says something that I'm like, ooh, there's a lot I want to say right now, and I could, and I'm like, what has happened when I did that before? It didn't turn out great. And there are situations like that where I'm able to think to myself and be like, okay, just maybe as much as you can. Sometimes it's not easy, but try the best to get yourself out of the situation. Sometimes not possible, but if it is, that's the biggest thing I'd say, that if you're in a situation that you know isn't going to go well, if possible, try to get yourself out of it as much as you can.
Thank you, Brianna. Ashley.
Yeah, so for me, it's like the symptoms that once, were a big part of my life, like the self-harm and the impulsiveness and the emotional outbursts, they're kind of taken a backseat as I've like gotten older and, gotten help. And just in general, I feel like just as age, certain things aren't as fun to cope with, I guess, so to speak. And that's kind of interesting because that's where the whole understanding of BPD being a spectrum kind of comes in and clicks for me, because it's not like a fixed experience. It's not like I'm this one time and this another time. I mean, it's the whole day. And sometimes I feel like it's playing like whack-a-mole, where I have to pick which skill or which, technique to use for certain situations. And, it doesn't like it had honestly it DBT. If it wasn't for DBT, I just didn't know how to do things. I didn't know what, coping ahead meant, which means like I guess if you're going to be, getting a tizzy when something doesn't go the right way, I do things like that now. When for example, when I feel like I can't control my situation. And so it really taught me like DBT. I've been doing it off and on my whole life. Sometimes, like I said, it's a spectrum. I need to be in my groups and the program, and some days, sometimes in my life, I'm okay. So if it really wasn't for like DBT and like resilience, it would be really hard for me to manage what I go through on a daily basis.
Awesome. I love to hear everyone's like top tricks for this. What role did having the BPD diagnosis play in your healing process? So if I know that a lot of this has been covered, so anything else, like once you've had the diagnosis, how did that play a role in moving forward?
Sure. So it was both overwhelming and freeing. It felt heavy, like I was being labeled and stigmatized, but over time it was just a way to experience myself in a better light. Like I was able to kind of verbalize what I was going through, and then my relationships grew stronger from that. And also just helped me find the right people. So yeah, I
I'm
guess it was,
actually, oh,
yeah.
sorry, finish what you're saying.
No, it just gave me clarity. And I was able to communicate what I was going through. And like Dr. Alex mentioned about identity, I was able to rebuild that sense of identity from a place of understanding and not shame.
Love that. Okay, so we're actually going to skip this question since some of it's repetitive. We're going to move on to the next one. Do you have any advice for other young people or young people in general who think they might have BPD?
Would you like me to?
You can start, yeah.
Okay. I think just don't be afraid to seek help from a professional. Educate yourself. Knowledge is empowering, and just the more compassion you develop for yourself and start to take care of yourself, it'll begin giving you a foundation for building a healthier life, creating those boundaries and using some of the tools for regulation.
I think definitely everyone says this, but I'm just going to emphasize the advocating for yourself and learning about the symptoms and what triggers them, because I know that it can be difficult because a lot of people might not believe you or understand, and advocating for yourself sometimes is the most you can do. And if you're able to learn your triggers and the symptoms, it makes it a lot easier to fully express and explain what you're going through and talking about.
Yeah, for me, it's sounds really cliche, but one thing Emotions Matters taught me is that resources sometimes really is the key to kind of helping you with BPD. And so I would say use the internet. That's my advice to young people. Use AI. You know, I didn't have access to like anything when I was in high school. So in all honesty, running a situation through AI, I've done. You know, in the past, it might have resulted in some questionable behavior, but now I can like take a breath and like think and be like, okay, my roommate has, you know, this thing in the fridge that's been smelling for a month and I don't know how to tell her because I genuinely do not have the skills. So it's like, okay, I'll go into the AI and be like, this is the situation. I just want to ask her if she doesn't mind, you know, cleaning out the fridge, but without it sounding so emotionally charged. And it worked. So I really want to say use the internet and use AI really to your advantage. Just take a second, even if you're in the moment, be like, you know what, I need to pause for a little bit, run it through, and it really, you know, it will really change everything. It really will, especially interpersonally when you're young.
Thank you, Ashley. So the last question is, based on your lived experiences, what would be helpful for family members, or if there's any clinicians watching, to know about BPD?
For me, I would say to the people that have BPD, just don't give up. Know that your sensitivity is a superpower, and to the community and like family members with people that have BPD, I think just know we're not trying to be difficult or dramatic. I swore, and a therapist dropped me just because I said the F word, not directing it at her. But do you know how rejected and ashamed that feels when you have nobody on your side? So just be consistent and supportive. Yeah, and things can get better.
Going off of part of what was just said, I'd definitely say the whole sometimes we lash out and say things, and I am speaking for myself and a lot of people who I know that also have BPD saying that I'll talk for me because I can never want to like hurt you, or sometimes I just lash out and my brain isn't working at the right speed, and it's just I feel completely out of control. And of course, I am very sorry if things are said, and I know a lot of people with BPD also feel that way. So I definitely would like any family members or peers or anyone around to know that it's not an intentional thing to hurt anyone. And for clinicians, my biggest thing I'd like to say is, specifically right now I'm talking about under 18 diagnosis, without having your mind already made up, just listen to what the person has to say.
Yeah, so for this one, I'm gonna like read what I wrote because I actually take this very seriously. So I think first it starts with clinicians. I would say don't be afraid to diagnose early, as you heard in Brianna's. You know, I'm like they're still saying that, like mind-boggling to me. And I feel like because of the complexities of BPD and the treatment modalities, especially like dialectical behavior therapy, it's really beneficial for emotional regulation, communication, relationship skills, and even if the person doesn't end up having, BPD. So by, like, for me, over diagnosing it is better than underdiagnosing it, because you're wasting time, treating something with medication, to be honest, is not going to fix. And that kind of in turn is the family experience, because I feel like, families are more able to adapt, because having BPD is complicated for families. It really is. And they're more able to, in a real world, we're all from different socioeconomic everythings. So you're going to be more likely to change your behavior as a parent, a family, a friend, when your 13-year-old, say, is acting out and throwing glasses, at you, than your 24-year-old daughter who's calling you for the umpteenth time again because she needs some money, because she's not doing the right thing. So I feel like the worst that could happen for a clinician to diagnose and it be correct is, oh, they learned some extra life skills. But it's way more detrimental the other way around. So that's what I would have to say.
Let me say one quick thing about treaters, in terms of advocating for yourself. Yeah, I mean, you point them to some of the resources I mentioned if they're concerned about diagnosing under 18. And, keep in mind, a lot of doctors are, most of the time, are trying their best. They may have just been educated in a way that is not the most up to date, or they learned 10 years, they're based off, working off information that's 10 years old. And so hopefully, if you point it out in a compassionate way, like, look, I mean, I think I might have this, and what do you think? That, I think that sets you up possibly, hopefully, for them to listen to that and take that into consideration. So.
Thank you for adding that. That's important. So we have like 8 more minutes. I want to thank you to Dr. Shep for answering so many questions that are now in the chat answered. So if anyone saw questions they wanted to see the answer to, you can look under Q&A and there's an answered section. There is one more question about quiet BPD, which I will throw to the panel. It says, does anyone on the panel have quiet BPD? Any words for those that do? I'm sure people who are watching might not know what that term is. In the clinical world, it's not really a term that's recognized. So I kind of want to hear from panelists and if they've heard of it and what they can say to it.
I'll say one thing. I'm not sure exactly what the questioner means. I'm guessing that a lot of the times people will suffer more from identity and interpersonal relation issues without necessarily some of the behaviors that tend to get more clinical attention, like suicidality and so on. So you can certainly have BPD where it's difficulties with your sense of yourself and establishing like intimate relationships and friendships. So if that's what they mean, that absolutely benefits from treatment. It's just maybe doesn't manifest in the ways that would, get the attention of emergency services and stuff like that. If that's what the person means.
I think so. Thank you.
Oh, I was gonna try an answer. So I actually just looked this up like last week, never heard of it. And when I was reading about it, it sounded to me like high functioning BPD. It sounded like something that I deal with more now that I've gotten those other, symptoms out of the way. And, and I've heard of it more in, the older crowd as well. So I would say that, it's worth, just like, Dr. Alex said, pointing it out to a medical professional. Like, just because your symptoms aren't screaming 911 on the outside doesn't mean that, they don't exist on the inside. And sometimes you have to, mention that, like Dr. Alex said, they might not even know what that is.
We have another question, and I really like this question because there's so many books about BPD out there. Someone would love to hear from the panel, what is the best BPD book overall? So maybe I'll throw it out and just say, like, if anyone has like one or two top books that either they or maybe one of your loved ones have read that have been helpful.
I'll be honest. Go ahead, Ashley.
Oh, I was gonna say, honestly, old school. I only read I Hate You, Don't Leave Me, and then I read Marsha Linehan's autobiography. So for me, I know there are a lot more books out there, but that like hardcore, OG book, I Hate You, Don't Leave Me, really helped me and people in my life understand, even if you don't read through the whole thing, the title sticks with you. The title is what it is. It's like, I hate you, pushing someone away constantly, but on the inside, you really just want to say, I need help, do not leave me. And so the book really is about deciphering that, from both the individual and the family side. And that book has personally like become my little mantra over the years.
Anyone else? I can say the book Beyond Borderline, I think, is wonderful. It has a lot of really hopeful stories about recovery from BPD. So in addition to reading books that are about BPD in general, I mean, it explains a lot of how BPD looks in different people, and then shows really the progress that can be made. So I think that's a wonderful book as well.
I do know that Emotions Matter. One of the resources I found through group was a podcast. Why am I blanking on their name? I love them and I listen to them.
BPD Bunch.
Yes, thank you.
I'm a former cast member on the BPD Bunch.
So I love it because you see and hear all these different perspectives, and then you're able to relate on both sides. As a family member, maybe it will help you from the perspective of your loved one. As the person with the lived experience, it could help put into words some of the feelings that you've kind of been facing.
Okay, I'm going to move on to another question. Let's see. In your journey to forge your identity, are there any messages or norms in conventional modern day society that you've disregarded because they've proved detrimental to your recovery? If so, what were they? And we got 3 minutes to answer this loaded question.
For me, I think it is just, I've heard, and this is just because on the other end, I'm older and stuff, work. It really has been troubling to find work that I fit into, that I don't feel like leaving in 2 years. And so I would say it's okay to not be doing, the 9 to 5 kind of corporate, thing. And if you are, it's also okay to leave it. It is hard as somebody who has BPD to keep the identity as, and try to mesh with what society wants. But I found that by actually giving myself a break when it comes to the one thing everybody wants us to do, which is work, 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 it doesn't work for me, and that's okay. And so I've managed to live and figure out ways to do that.
All right, we're going to actually end there. I'm sorry, not everyone's going to have time to answer that, but Paula is going to take it over and finish up.
Well, I really want to thank our panelists. It takes a village, and we're so grateful for your time this evening, for your vulnerability, and for giving voice to so many of the experiences that ring true from the community. I've been watching the hearts and the emojis and all of the comments. And thank you to Dr. Shepp and Dr. Stein for answering the Q&A during the session, which was really helpful. We have 2 more webinars left in our BPD month series. Next Wednesday night, we have Dr. Sarah Masland from Pomona College in California, who is an expert on BPD and stigma, who will be presenting along with some fabulous panelists who are going to tell you their real world experiences of stigma and how they've managed it. So that is next Wednesday evening at 7 o'clock Eastern Standard Time. Then 2 weeks after that, let's hear it for the boys. We have our leaders of our men's group who are going to be giving voice to their experience of finding community. And they'll be talking about their experiences as men with lived experience of BPD. So we really hope you'll join us for these next 2 sessions as we round out our BPD month series. And tomorrow is May 1st. It is the first day of BPD Awareness Month. We hope you're going to join us, whether you're walking virtually or in New York City. June 1st is our Walk for BPD. Our goal this year is to get support from all 50 states and abroad. We have a beautiful map on our website. We have 14 states currently represented. But this is our core fundraiser annually, where we raise money to be able to pay for our peer support groups. And every dollar counts. We have a $100,000 fundraising goal. So we're asking everybody, please make a donation, get a shirt, walk virtually, watch the YouTube live, come to New York if you can. It's a great way to come meet us and to be part of our BPD community. So there should be a link in the chat where you can find out more. We also have a fabulous lineup of speakers. If you enjoyed hearing Brianna will be one of our speakers in New York. Dr. Shep is also usually there, and lots of our board and staff will be there. So we hope that you can join us. Also, we do have a post-event survey that we do ask our attendees to fill out. We read them every week and make adjustments as we go. So if you can't fill it out tonight, you will get an email tomorrow and asking you to take the survey to give us feedback on this presentation tonight. So again, thank you all for being here. If you have questions that we were not able to answer tonight, please feel free to email us at info@emotionsmatterbpd.org. And we will try to get those questions answered or get them over to one of our panelists to answer for you. So thanks again so much. Have a great night wherever you're from. Thank you for lighting the world on fire and making our BPD community a little brighter and safer. Take care now. Bye-bye.